Greetings. Buenos dias. It is my great pleasure to be presenting on this topic of cannabis and neuroprotection to the Congress in Costa Rica. My name is Dr. Greg Gerdeman. I am a longtime researcher and educator in the area of neuroscience and cannabis pharmacology. I have a PhD in pharmacology from Vanderbilt University and was a tenured college professor of biology for several years at Eckerd College in St. Petersburg. I've been researching cannabis and the human cannabis relationship um, for over 20 years. And from that, I have gone into the cannabis industry. So I've experienced cultivation and extraction and formulation of cannabis products. And I'm presently co founder of a startup company called NashX, the Nashville Commodities Exchange, where my company is working in the hemp industries to connect the growing market of buyers and sellers for products derived from this plant. So I have a wide range of interest, and it started again over 20 years ago. Here's a picture of me in the top left of doing graduate work late night in the lab, trying to explore how the cannabinoid receptors interact with neural tissue in in rodent brains. So this is a very technical scientific talk for sort of the medical tract about these important questions of cannabis and how it works in the brain in terms of neuroprotection. My interests at large are the neurophysiology of endocannabinoid systems, their function, their evolution, and what that means for the biological mutualism between humans and cannabis, including the use of cannabis as medicine. But of course, there's so much more that we use with this plant for the benefit of both species, and that's what mutualism means. And my current goals involve developing efficient, regenerative cannabis hemp industry value chains. So it's a great pleasure to be here. I wish I could be there in person, and I look forward to being live for questions and answers. So moving ahead, because this is an information pack talk, as a general outline or sort of take home points, the endocannabinoid system that cannabis acts on is a neuroprotective biology. The ECS, as we call the endocannabinoid system, mediates homeostatic responses to injury and inflammation and other sources of damage in the human nervous system. Phytocannabinoids, meaning plant cannabinoids from cannabis, engage the endocannabinoid system and act as neuroprotective agents themselves. Now, these comments, I want to emphasize right now and throughout the talk that what I'm stating here is not controversial in the slightest to scientists who have studied the endocannabinoid system over these past decades. So, another part I want to touch on here is the question of, does cannabis use damage the brain? Now, that may not have been evident in the title, but as we emerge into a more sophisticated global cannabis marketplace, moving past the prohibition of the 20th century, it's hard to talk about cannabis being neuroprotective without being countered by perceptions that cannabis use damages the brain. So I'm going to address that head on in this talk in the second part. And I'm going to point out that there are some brain imaging studies that suggest small structural alterations in cannabis users. And there are psychological studies that may detect neurologically disruptive consequences of cannabis. We know that cannabis has short term impact on learning and memory and some aspects of psychological performance. But as an overall take home, and this comes from 2 decades of rigorous scientific research, which I have followed, the research on cannabis and the endocannabinoid system as a neuroprotective uh, biology is highly consistent. It's reproducible. It has been reproduced in dozens, even thousands of scientific articles, and it's exciting. Research that points towards cannabis use being damaging to the brain is inconsistent. It's usually marred by very distinct bias, and yet this is what gets publicized and sensationalized in the media and influences policymakers, influences way too many physicians to not look past those headlines. I'm going to try to hit some of that head on and see if we can play this balance between the science of neuroprotection and the science of does it damage the brain. Now, the effects of cannabis in the brain are important, and undeniably, this is the root of human attraction and relationship to this plant. Human attraction and aversion to cannabis has been motivated by our fascination with its effects on the brain. And it's been that way since prior to any historical record. And for example, many ancient cultures used cannabis. And I draw a quote from a wonderful review, not that highly recognized, from Meshulam and Ben Shabbat. I quote here that about 3,000 years ago, looking at the culture of ancient Assyria, they left us a pharmaceutical legacy on hundreds of clay tablets. Cannabis was one of the major drugs of their pharmacopoeia, as it was in Egypt and in China. Apparently, the Assyrians named the plant according to its use, with many names. Kunabu is one that seemed to have been used in certain rites. Azalu may have been the medical term as well as referring to hemp. And this one, Ganzingunu, has been translated as the drug that takes away the mind. And I put this in this talk not only because I love to think about this ancient history and I can talk a whole hour on that, but I think it shows us that this tension between cannabis as a therapeutic and a widely useful plant, and the fact that it does have profound effects, sometimes disruptive, unwanted effects on consciousness, this is nothing new. Societies and medical systems have wrestled with this throughout human history. But in the 20th century, focus on cannabis research was not so even-handed. It was extremely slanted to ask these questions about how does marijuana, a name which of course was introduced in a more of a derogatory way, a xenophobic way, how does marijuana make people stoned, make users lazy or addicted or even violent? How does cannabis use create mental impairment or schizophrenia? The model that cannabis and THC is neurotoxic became promulgated primarily by this rich history of propaganda. If you look at just a couple of snapshots, there's a screenshot from the famous propaganda film Reefer Madness, and this kind of image of the smoke of hell, the devil's weed, with its arms around your children. This kind of propaganda is what not only influenced American and global societies and cultural views towards cannabis, but it led to the research agenda. So the biomedical research onto cannabis was all asking these kinds of very biased, negatively focused questions. And yet, even so, with a research agenda to ask how cannabis is dangerous, it led to the discovery of the endocannabinoid system, which this talk is not an introduction to the endocannabinoid system. I'm presuming there's some other introductory content at this conference, but the endocannabinoid system we now understand is tremendously important. It's how cannabis works. And I shift here on this slide to a very brand new paper. A journal, this journal Molecules, has put out a special edition honoring the 90th birthday of Professor Rafi Meshulam. And in this editorial, Dr. Mauro Maccaroni from Italy has this quote that I love. I stuck up here. I was just reading this. The endocannabinoid system he's referring to with such a system, along with plant-derived cannabinoids themselves, is now widely recognized for its therapeutic potential in almost all human diseases, as suggested by the ever-growing number of investigations that can be retrieved from a PubMed search. I, of course, underline this because we can't emphasize this enough. We, as an industry, as a science around cannabis, that this is not coming from the weed culture per se. This is coming from mainstream science. It's as mainstream as science gets, and it's global. That the cannabinoids are recognized for their therapeutic potential in almost all human diseases. That's tremendous. And one of the biggest is neurological disease and neuroprotection. I show here the table that Dr. Macaroni uses, and it's just to highlight a little bit of my perspective. Where I circle here, this 5 years from 1996 to 2000, this is when I was in graduate school, and you can see that just over 100 papers were published dealing with cannabinoids or the ECS and disease. But the last 5 years, from 16 to 2021, there are well over 3,000 scientific peer-reviewed articles touching on how cannabis and cannabinoids influence disease. And I echo Dr. Macaroni's sentiment here. Both of us have been in this field for this entire stretch of time, and the balance of research clearly is not towards cannabis causing disease, it's towards cannabis being therapeutic for the treatment of disease, because the endocannabinoid system is part of our own resilience to disease and injury. And again, this is mainstream science, and it's not new. I show here on this slide a couple of titles of review articles. I'm not giving exhaustive citations in this talk, but it is so easy to do searches and find these kinds of articles. Like in 2003, Meshulam and Lichtman wrote this review in Science magazine, Stout Guards of the Central Nervous System, referring to what the ECS does. And here's one from Katona and Freund, Hungarian scientists, endocannabinoid signaling as a synaptic circuit breaker in neurological disease. Endocannabinoids in neuroinflammation and traumatic brain injury. There are lots of literature reviews to show how much we know about the endocannabinoid system being protective. Endocannabinoids are guardians of the nervous system. That's the key to understanding why cannabis and the cannabinoids in cannabis work to also protect the nervous system. And again, this statement is not controversial in the slightest, except to people who don't study the science. The early evidence for this statement, which is one of the first things discovered about anandamide and 2-AG, the endogenous cannabinoids, is that physical trauma or seizure activity in experimental models in animals rapidly and very significantly elevates the level of endocannabinoids in the brain. And likewise, if endocannabinoids as chemicals are administered to animals, it attenuates seizure activity. It reduces the extent and severity of brain injury in different experimental models, and it reduces the severity of inflammation. Any physician in the world should know that inflammation is at the root of so many metabolic, neurological, and cardiovascular diseases, and the endocannabinoid systems reduce inflammation in the brain and other tissues. That's why cannabis works to do the same. And a take-home message here is that looking at the span over 2 decades of research, the endocannabinoid system, which is mimicked and activated by multiple bioactive compounds in cannabis, is an innate system of neuroprotection. It's something to be excited about. But wait, you talk about this publicly, including to physicians and hospitals and policymakers. The response is, isn't it cannabis and weed bad for the brain? This image right here, of course, comes from iconic commercials from the 1980s. This is your brain on drugs, and you get a frying egg because you're destroying your brain. But I didn't take the picture from there. I lifted this picture from a brain and spine institute in the state of Colorado with a physician writing a blog about how cannabis is dangerous to your brain. And um, it's my position that this physician is badly misunderstanding the summary of the scientific literature. And yet, to give a benefit of the doubt, if endocannabinoids are an innate system of neuroprotection, which science clearly shows they are, how is it that plant cannabinoids would be damaging to the brain? On first, uh, supposit, you wouldn't think that would be the case. Well, the best argument, I think, is that maybe because the endocannabinoid system is synapse specific, it's transient, meaning endocannabinoids go up when and where they need to in the brain, and then they go back down. So maybe if you're taking plant cannabinoids by ingesting cannabis, it overruns the system, it swamps it, it's too high of a dose, and that becomes toxic even though the system that is mimicking is protective. Now, that's the argument. I don't think it's supported by the evidence. Are there cognitive effects of cannabis? Yes, of course there are. Is there impairment from those cognitive effects? Yes. There are performance impairment, learning and memory impairment that happens on the short term, but these are temporary. And I'm referring to a large balance of literature that supports this, and it's not, surprising to say. So, does cannabis actually cause damage to brain cells and brain health? It's a very important question. It's not trivial because the label of brain damage carries tremendous implications, including the continuing stigmatizing of this medicine, the barriers to opening real research, and widespread use of medical cannabis in the community. And yet, the data overall are widely negative that there's any damage to brain cells or brain health in any kind of lasting way. I'll summarize some of that as we move on here. The way I look at what the literature has shown us, and by literature I mean 20 years of intensive preclinical science, is that, as I say, there are multiple cannabinoid pathways to promote brain resilience and repair. What are the things that damage neural tissue, brain tissue? Well, there's, as I list here, excitotoxicity, cell damage due to excessive excitation and calcium signaling. There's reactive oxygen species, which cause oxidative damage. Cannabinoids block that because they're antioxidants. In fact, both delta 9 THC and cannabidiol are more potent antioxidants than vitamin E, which is sort of the frontline clinical antioxidant therapy. Uh, Brain and neural damage is also caused by reactive microglia. Microglial activation and pro-inflammatory cytokines are part of what come in and create damage. Cannabinoids decrease excitotoxicity. They decrease reactive oxygen species by soaking them up as antioxidants. They also decrease through multiple mechanisms, microglial activation and the stimulation and release of pro-inflammatory cytokines. There are dozens of papers showing this. It's very exciting, very mechanistic research, technical work showing that this is the innate immune response that causes neuroinflammation. And on these multiple points, endocannabinoids and plant cannabinoids acting on the ECS dampen that innate immune response, making them therapeutic for many situations. Also, on a short term, cannabinoids increase vasodilation and cerebral perfusion, which can help to bring healthy blood flow back to an injured brain and increase neurogenesis, the growth of new neurons from neuronal stem cells, which can be we now understand, can be part of the repair and longevity of neural tissue. So exciting stuff, and I'll step through some of this briskly. First, excitotoxicity. What is it? Well, to understand excitotoxicity, one has to understand that there are excitatory synapses. That's how the brain communicates. An excitatory synapse is formed when one neuronal axon excites its target cell. Simply enough, I've depicted here a very simple neural circuit of two cells. Neuron 1 releases the excitatory neurotransmitter glutamate onto a target cell, neuron 2. And when that happens, it pushes that cell to fire action potentials, as indicated by the spikes there. It also pushes the target cell to release endocannabinoids, which travel backwards. They're generated by the membrane of the target cell, travel backwards and act on presynaptic CB1 receptors that reduce that glutamate release. It's a negative feedback and sort of pumping the brakes, like that's too much excitation, let's turn it down. And the endocannabinoids, it was so exciting to be part of discovering this phenomenon in the 2000, 2001. The endocannabinoids act very widely in this way, not only in the brain, but throughout the body. And we call it a retrograde messenger activity. Endocannabinoids act as retrograde messengers at excitatory synapses and thereby blocks the excessive accumulation of glutamate that becomes toxic to cells when there's excitotoxicity. And when does that happen? Well, with seizures, obviously, excess activity, with stroke, with other head wounds, with various clinical conditions, excitotoxicity leads to damage. What I'm trying to impress is that the plant cannabinoids can help through mechanisms like THC directly acts at CB1 receptors, imitating the endocannabinoids. Cannabidiol, CBD, can promote endocannabinoids by blocking their breakdown and also acting at some other receptor pathways that we're learning a lot about, but seems very much complementary with the endocannabinoid system. Many preclinical animal studies show that the endocannabinoids are an on-demand defense against excitotoxicity. As an example, let's look at stroke. Now, with stroke, you see this kind of terminology to impress upon people that if you're having a stroke, you need to get help in the hospital because time lost is brain lost. What does that mean? Why do we think cannabinoids can help? Well, here's an example of an experiment showing that cannabinoids can have positive outcome on an experimental stroke. Now, this is animal research, and what this image is showing is stained tissue slices of a rat or mouse brain. I can't remember which mouse, I think. Um, and it's important to mention that animal research doesn't always parallel the human condition, but with ischemic stroke, it's an exact replica of what's going on because literally what happens is the experimenter occludes the medial cerebral artery, which is feeding the blood supply to the brain, blocks blood flow for several minutes, and then lets the blood flow back. And that is exactly what happens with an ischemic stroke. And what we're seeing here, if you look at all of these tissues were subjected to that stroke, the artery occlusion. On the saline side is a control on the left, and the graph quantifies how large the damage was, called the infarct. In the middle is treatment with a drug called ACEA, which is a THC anandamide analog that acts as a CB1 receptor activator. And you see on the red bar that the amount of damage was lower. And on the right is an animal that was pretreated with a drug that blocks the cannabinoid receptors. And you see that it even showed an increase in the damage. It certainly prevented any therapeutic outcome of the cannabinoid receptor. This is just to give you an example of some of the kind of research that supports this, of which there are many studies. And as a summary, this is what we've learned from these studies. When the reason we say with stroke time is brain or time lost is brain lost is because when a stroke occurs, the amount of damage is actually focal. It's limited to what's called the ischemic core, which I depict as a cartoon on the left. And it's caused by direct hypoxia, loss of oxygen. But in the following hours, 12, 24, 48 hours even, that hypoxia leads to a absolute escalation of our own inflammatory immune response. These inflammatory mediators like TNF alpha and the interleukins 1 beta and IL-6, they go up. Leukocytes and microglia infiltrate the brain and get activated and start to cause cell phagocytosis and glial proliferation. So over the course of even 48 hours or more, the ischemic core expands to what's called the ischemic penumbra, which is the damage gets bigger, and it's largely a product of the innate immune response. So you have to treat that by dampening that response. Well, what happens when experimentally cannabinoids are introduced? Cannabinoids literally block every single one of these processes, every one. And this has been replicated in many studies, and it leads to a decrease in the size of the ischemic penumbra, which means the severity of the damage is less. This is so important. Here's a review. Don't take my word on it. Look up this systemic review, a meta-analysis by the lab of Dr. Saoirse O'Sullivan in Nottingham, England. They did a whole review of cannabinoids and experimental stroke, and I grabbed some quotes here that they looked at controlled studies assessing acute administration of cannabinoids for experimental stroke. And what they found is that cannabinoids significantly reduce the infarct volume, that's the size of the damage, and improve functional outcome in experimental stroke, which, as I said at the beginning, is a very good model, exactly what happens in actual ischemic stroke. And I love this quote: the pleiotropic effects of cannabinoids on the ischemic penumbra and cerebral vasculature after stroke, combined with their excellent tolerability, make them promising candidates for future treatment. I underline excellent tolerability because this too is not controversial in the research world, that cannabinoids like THC even and CBD are very well tolerated. You would think that this would have led to clinical trials looking at plant-derived cannabinoids in stroke, but there's not been a one, not a single one. And it's even kind of a very like for me to talk about cannabis being a therapeutic approach for stroke is not something you could talk about as a company who's trying to sell cannabinoids, because it would be considered uh, way overstepping. And yet the research is very strong preclinically. We even have some circumstantial human evidence that I put on this slide. For example, this study that was published in the journal Cerebrovascular Disease in 2016, prior cannabis use is associated with outcome after intracerebral hemorrhage. This study looked at a multinational group of people that had spontaneous intracerebral hemorrhage, or a bleed. And they found that in nearly 10% of those patients, they were cannabis users. They did a correlation looking at THC levels, and people who were cannabis positive patients, when they had their intercerebral bleed, had milder symptom presentation and less disability at discharge than those who did not have THC in their system. This is circumstantial evidence, but compelling. Likewise, a study done in Los Angeles, published here in the American Surgeon in 2014, looked at a population of patients who presented to emergency rooms with traumatic brain injury after car crashes. And they looked at THC urine screens, or blood screens rather, and showed that positive THC in the blood was associated with decreased mortality, meaning increased survival, in patients sustaining traumatic brain injury. Again, circumstantial, but combined with a mountain of animal research showing that it really ought to work. Why don't we move more into clinical trials? There's plenty of review. Again, this isn't new. Look at this. This is from Esther Shahami in Israel, 2011, published in the prestigious British Journal of Pharmacology. If you look at this slide, it's fairly complex, but start at the top left, summarizing what happens with brain injury. Well, it leads to all these harmful mediators: glutamate, reactive oxygen species, cytokines. These are the things that cause damage, as I've reviewed here. And those things lead to excitotoxicity, inflammation, vasoconstriction, and all the secondary damage that cause brain injury to get worse over time. But what we know from the endocannabinoid system is that brain injury also simultaneously creates part of the tools for brain repair and protection, which are the endocannabinoids. They are the innate system of brain protection and repair. They inhibit all of these different steps, as I've already outlined, and they promote the growth of new stem cells through neurogenesis, which might help to limit or repair secondary damage. So it's really not scientifically controversial that endocannabinoids are part of a system, a major, major system of neuroprotection. And here's a review from 2007, an image talking about cannabinoids and neurogenesis, which is exciting subject, where again, with brain injury, we know that you get the rapid elevation of endocannabinoids. That is the brain's first response alarm system, releasing endocannabinoids to protect itself. And not only does it dampen all of this excitotoxicity and inflammation, but it goes to active neurogenic zones in the brain and stimulates neurogenesis. This is true also, by the way, this is very relevant to psychedelic compounds that stimulate neurogenesis, which is another topic, but one which there's growing interest in the cannabis community. So let me get back to the flip side of the coin, because again, as excited as I can be talking about this, I can be countered by folks in the medical community saying, no, 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 I've heard that cannabis is damaging. Doesn't it disrupt normal brain development? Doesn't it damage the growing brain? Well, look, endocannabinoids regulate all kinds of neuroplasticity, so it is something to be concerned with. Maybe cannabis use could interrupt normal brain development. It's a reasonable hypothesis. Maybe it could damage the growing brain. We do know that very high THC injected into mice and in cell culture has, in some experiments, caused damage. So we have to pursue that. It's a very important question for the medical and social use of cannabinoids and cannabis, but we have to ask, how serious are these possible side effects in the context of a vital medicine? Because medicine always has certain side effects, and we have to balance whether the side effect is more important than the vital aspect of why you're using the medicine to treat injury and disease. The question of whether cannabis alters the brain is one that has been addressed by very sophisticated imaging studies. And a lot of times, this is the kind of media coverage it gets. Harvard scientists studied the brains of pot smokers, and the results don't look good. This is angled negative towards the beginning. It's referring to this study right here that came out in the Journal of Neuroscience in 2014. And this study found small volume changes in areas of the brain that were associated with cannabis users, not super heavy cannabis users, but regular cannabis users. However, it did not found any correlation to any decrease in performance. These were college student volunteers who did not have any obvious impact on performance, and yet they said that they found small changes in the brain. Now, as an important caveat, cannabis users in the study were also more likely to be alcohol drinkers. And by contrast with cannabis, the association with alcohol and causing abnormalities in brain function and brain structure is cut and dry. There's such literature showing that heavy alcohol use causes a negative impact on the brain. But yet we're still always fishing for trouble with cannabis. Here's some of the data. It's technical. We need not go into it at this point in the talk. But basically, here's an example that they showed, for example, an increased volume in the left nucleus accumbens and a slightly different three-dimensional shape of the right amygdala in the limbic system. I want to point out to you that these changes are so subtle that a trained neurologist could never look at these scans by eye and say this one is smaller than this one. It requires sophisticated computer analysis of the imagery in order to say, yep, there is some significant change here. And those analyses actually can change if there's changes in the algorithms that run those scanners. But at any rate, you have these slightly different changes. And my problem with it is they didn't show any damage. They showed a change, but they didn't show a damage. Now, this study was replicated very promptly by a group mostly out of Colorado. Weiland et al. In 2015 was published in the same journal, the Journal of Neuroscience, and they controlled for alcohol use. They used the same methods as the Harvard study, but they had greater numbers of subjects and therefore statistical power, and they found no correlation between brain structures and cannabis use. So they even reviewed the literature. Here in this image, on the left side, you got a list of all the studies that had been using brain imaging at that time to assess whether cannabis use affected brain morphology. And as an example, like I circle here, like the green circle is the left amygdala. And if you look at this figure, some studies show the left amygdala larger in marijuana users than controls. Some of them show it smaller. On some, there doesn't seem to be a consistent uh, pattern. And all of these brain image sizes are within normal variation. It's not like you're seeing massive deficits here. This is a lot of text to put on a slide, but I love this from the discussion of this paper. They pointed out that clear evidence regarding the effects of marijuana on the brain and on health in general are important for informing the public and policymakers. And the press may not cite studies that do not find sensational effects, but these studies are still extremely important. While the literature does support a deleterious short-term effect of marijuana on learning and memory, it seems unlikely that marijuana use has the same level of long-term deleterious effects on brain morphology as other drugs like alcohol. It's imperative that rigorous research accurately identifies the harms associated with marijuana to better inform policy and perception. Now, so did this impact? Well, here's these two papers, title by title. The top one that shows the cannabis use associated with abnormalities in the amygdala, even though they were all within normal range. This has been highly cited by drug abuse policy luminaries in the US and elsewhere. And the lead author, Dr. Breiter, was quoted in the press saying, "This is not a part of the brain that you want to mess around with." Whereas the follow-up paper that was showing that this is not a big cause for alarm has been virtually ignored by the media and by drug abuse research leaders. I'm going to touch on a few other examples here at the risk of hitting you with too much data, but there's also, here's two studies that appeared in October 2015 in JAMA Psychiatry, showing that, again, looking at a twin study, they were looking at twins, and differences in amygdala volume when one twin was cannabis user or one wasn't, was attributed to common predispositional factors, genetic or environmental in origin. It has little support for a causal influence, meaning little support that cannabis use itself caused these subtle changes in the subcortical structures of the brain. Likewise, with schizophrenia, this study found that genetic factors associated with cortical development are likely mediating observed connections between cannabis use and the development of schizophrenia, so that heavy cannabis use may be a risk factor for precipitating schizophrenia, but it is not a direct causal effect in and of itself. Another study out of London in 2015 was looking at the effect of what they called high potency cannabis on the microstructure of the corpus callosum. The corpus callosum is a white matter bridge that connects the two hemispheres of the brain. And they found that in users who used high potency cannabis, not only if they used very high potency cannabis regularly, that it was associated with what they called a disturbed microstructure of the corpus callosum, with and without psychosis. See, they were trying to make a connection between cannabis use, brain damage, and schizophrenia. But what they found is that regardless of whether users were high cannabis users or not, it didn't predict whether they experienced psychosis. So that's negative. These very small changes in the structure of the white matter also was not predictive of psychosis. All they found is that heavy cannabis users had a detectively different small difference in the microstructure of this brain pathway. So why is the cannabis use inferred to reflect damage or a disturbance? That's coming from the explicit bias that's coming into the research. So my general critique of brain imaging studies, of course, still in the context of understanding that the endocannabinoid system is neuroprotective, not damaging. So why would cannabis cause damage? My critique of these brain imaging studies that get so much traction is that brain microstructural alterations, and I emphasize micro because these things couldn't even be detected without the sophisticated brain imaging studies scanners of today. These microstructural alterations, yes, they can be found among chronic, heavy cannabis users, but typically in the absence of any clear correlated functional consequences. And to interpret these differences by default as a disturbance or a damage or a compensation for damage is a reflection of institutionalized negative bias, not scientific objectivity. It comes into play with IQ too. This PNAS study was very widely cited, showing that long-term cannabis users may show decreases in IQ. The science led to media hype, irreparable drop in IQ from using cannabis as a teen. But follow-up critiques said, you know what, this wasn't done well. They didn't control for socioeconomic status. The IQ was a modest change, but these critiques get very little attention at all. Here's an assessment from a review that I think is very sober and competent. Again, many reviews of this. And from these authors, Nader and Sanchez, they concluded from their review of this extensive scientific literature that it suggests evidence of subtle changes associated with regular cannabis use in cognition as well as in brain structure and function, and possibly altered pattern of brain activity. That's what the summary of all this research shows, that there is evidence of subtle changes associated with regular cannabis use. Well, we know cannabis use influences the mind and the brain. If there are subtle changes in the physical structure of the brain, why is that alarming? If why do we assume it's damage? And these findings concentrate on heavy recreational users and are unlikely to represent most casual recreational users, or I would add, the medical patient. So I'm getting close to wrapping up here with concluding thoughts. Cannabis is a medicine of the present and future, not just the past. And one of the main reasons and utilities for cannabis and cannabinoids as medicine is that they are neuroprotective. We know that. Research should be unshackled to investigate how and when they are neuroprotective, under what circumstances, what doses are needed. This should be moved forward. The biological axis between processes of inflammation and neurogenesis and brain repair is a conceptual frontier of understanding the brain and human health, and endocannabinoids are right at the leading edge of that. Phytocannabinoids, plant cannabinoids, are also acting in multifaceted ways on this same system to be protective and promoting of repair and health. And the potential effects of other biomolecules in cannabis, like the various terpenes and aromatic terpenoids, they have various possible interactions with other mechanisms in the body that are also very exciting. So the summary perspective of the negative work, brain morphology changes reported in these brain scan studies should not be interpreted uncritically as damage. This is a reflection of deep institutional biases that continue to favor research aimed at uncovering hypothesized risks and interpretations that emphasize potential risks. These biases can and do shape public health concerns around medical access to cannabis, and I'm so glad to see in jurisdictions and places around the world, including Costa Rica and other areas of Latin America, that we are starting to grow out of these biases and their stigma and the barriers that they have given against this medicinal natural plant. Advocates for medical cannabis cannot flatly dismiss science, however, that claims to describe adverse outcomes, because they can be spectacular sounding and impactful, and we need to have experts in the community that provide critical and objective review, learn from new findings, and identify those that are spurious or problematic. As cannabis medicines advance socially, there's need for pharmacovigilance, which of course means following up with patient use and public use of cannabinoids to find out if there are challenges and problems that arise. Otherwise, if we just make the mistake of confusing correlation with causation, then we get into the reality where the new brain sciences and brain scanning, it may be no better than the older study of phrenology, where the ideas of brain structure influencing disease or competence was wildly exaggerated. We have to check ourselves on our prejudices, realizing that cannabinoids are neuroprotective, and that we can't misapply those prejudices to the use of a very safe, well-tolerated, real natural medicine. This is my closing slide, just to emphasize that some of what we get put out in the media in modern days looks very much like the propaganda that was used to demonize cannabis 80 and 70 years ago. So I have various different slides here, references that can be reviewed. I thank you for your attention. I'm happy to take questions, or I can be reached at drgerdeman.com, and I'm happy to help. Thank you very much.